When receiving a patient, we should politely greet and introduce ourselves to the patient. Assess and identify patient hopes and expectations thoroughly during the history taking. In this video, the patient is a graduate student with hopes to be accepted in the army. As usual, the doctor measures patient body weight and height in order to evaluate the patient's general condition. The arm, the shoulder. There are 4 movements of the shoulder. Shoulder abduction, shoulder flexion, shoulder extension, and shoulder adduction. Elbows range of motion. We use a goniometer to measure the joint's range of motion. There are 4 movements of the elbow: flexion, extension, supination, and pronation. This is the rest position of the hand. Wrist extension, wrist anterior flexion, radial deviation, and ulnar deviation. The leg, the hip, hip flexion, hip internal rotation, hip external rotation, hip adduction, hip abduction, hip circumduction, and hip extension. The knee, knee flexion, and knee extension. The ankle, foot dorsiflexion, foot plantar flexion, leg length measurement. Measuring the true length of the leg. Measuring the apparent length of the leg. Measuring the circumference of the lower extremity. Evaluate for any alteration found and relate them with the patient's history of morbidity. The spine. Spine examination. Examine the patient posture from the head down to the distal part of the waist. The head is in the center position between the shoulder to the sacrum level. Ask the patient to flex his body forward and thoroughly assess for any sign of asymmetry. To assess for any stiffness of the spine, be sure to check the lumbosacral junction. In normal condition, the distance will gain approximately 4 cm in length. After the complete examination and physical examination, the doctor discussed the finding with medical student and his resident in training.